Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. My name is Brenda, and I'm a National Board Certified Health and Wellness Coach. Today, I will discuss practical boundary setting strategies. The information provided in this video is for educational and informational purposes only and is intended solely as a self-help tool for your own use. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding your health. If you are in distress, please seek immediate medical attention. As with all of my video presentations, I encourage you to keep a notebook and writing utensil nearby. This allows you to apply the concepts and strategies to your own personal experience. Does it feel like everyone around you needs something? Do you feel like you are being stretched in many directions much of the time? We need to set healthy boundaries, learn to say no, and develop clear expectations and limitations with family members, friends, and coworkers to ensure we are physically and emotionally healthy for ourselves and others. In this video session, we will explore practical strategies for setting boundaries. First, you can give yourself permission to set personal boundaries with other people. It's okay. Just like we need to set limits with small children for their own safety, it's also important to set boundaries with adult family, friends, and coworkers. We can also identify boundaries we need to set for ourselves. For example, we can limit the time we scroll on our phones or watch television. We can limit our caffeine intake, or we can make sure we're in bed by 10 o'clock p.m. You can pause the video and respond to the following question. In what areas do you feel like you need to set boundaries for yourself? So how do we set boundaries? Setting boundaries involves a three-step process. In step 1, we define our boundaries. We are clear and straightforward without raising our voice or displaying strong emotions. For example, I might set a boundary of not picking up my phone after 8 o'clock p.m. This type of boundary impacts others because they have to realize I don't make or receive phone calls after 8. It impacts me because I'm limiting my own phone use behavior. In step 2, we clearly communicate our need or request directly in simple terms of what we want or need, rather than what we don't want or like. Staying with the same phone use example, I need to communicate to others that I do not access my phone after 8. I can determine if this is a hard boundary or a soft boundary. This is a bit of a tricky area because we want to be available if someone has an emergency. We can explain to family, friends, and coworkers that we don't accept phone calls after 8 unless there's an emergency. In step 3, we reflect on how this made us feel. Accept any discomfort that arises as a result, whether it is guilt, shame, or remorse. Again, using the phone example, we can quickly observe if there are violators or people who push this boundary, and to what extent they push the boundary. We can also observe if we're respecting the boundary we set for ourselves. We can notice what feelings are attached to this process. Take a few minutes to write down 1 or 2 scenarios where you can use this practice. The next strategy is to practice saying no. You can pause your video and complete the following activity. Make a list of things that you feel like you need to say no to. Circle up the 3 items that you can set relatively easy boundaries. Make a plan to act on one of these items. Hopefully, you now have some go-to strategies that will help you set boundaries with yourself, family members, friends, and coworkers. Take a moment to thank yourself for taking this time to care for your body and mind. As we close, remember, your health matters. Thank you for accessing the 4th video, Practical Strategies for Boundary Setting, in the Setting Boundaries series. The Office of Correctional Medicine at Southern Illinois University School of Medicine invites you to explore more educational content in our Health Matters series.